Every heartbeat is precious, but some heart conditions remain silent until it's too late. Aortic disease and heart valve disease can affect anyone. Early diagnosis can save lives, but awareness must come first. Introducing the Indian Aortic and Heart Valve Alliance, a national movement bringing together patients, caregivers, healthcare professionals, and communities to raise awareness, support patients, and promote earlier diagnosis across India. Together, we can save lives through awareness. हर धड़कन की अपनी एक अहमियत है, लेकिन दिल की कुछ बीमारियां चुपचाप बढ़ती रहती हैं और अक्सर उनका पता बहुत देर से चलता है। महाधमनी, एओर्टा और हार्ट वाल्व की बीमारियां किसी भी व्यक्ति को हो सकती हैं। अगर समय पर पता चल जाए तो जान बचाई जा सकती है, लेकिन इसकी शुरुआत जागरूकता से होती है। पेश है इंडिया एओर्टिक एंड हार्ट वाल्व अलायंस, एक राष्ट्रीय पहल जो मरीजों, उनके परिवारों, डॉक्टरों और समाज को एक साथ लाकर जागरूकता फैलाने, मरीजों को साथ देने और समय पे जांच का बढ़ावा देने के लिए समर्पित है।
Welcome to Heart Health Conversations, where we simplify heart health, one conversation at a time. Our guest today is Professor Dr. Niranjan Hiremath. He is the surgical lead of the Aortic Center of Excellence for the Pan Apollo Hospital's surgical program and is internationally trained in complex aortic surgery, heart valve surgery, and TAVI.
Welcome to Heart Health Conversations. I'm Shehzad, founder of the Apple Tree Health Foundation, a patient advocate, and the driving force behind the India Aortic and Heart Valve Alliance. This podcast is dedicated to raising awareness about aortic disease, heart valve conditions, patient recovery, and the stories that have the power to save lives through awareness and early diagnosis. In May last year, I underwent a Bentall procedure and aortic valve replacement. What began as an unexpected diagnosis of an aortic aneurysm, which became one of the most life changing journeys for me. Today's episode is deeply personal. I'll be looking back on my own journey and asking the questions that every patient asks, from diagnosis and surgery to recovery and life afterwards. My hope is that this conversation offers reassurance to patients and families while raising awareness about aortic disease, a condition that often remains silent until it becomes a medical emergency. Well, it's my privilege to welcome someone who not only changed my life but has dedicated his career to giving thousands of patients a second chance at life. Please join me in welcoming Professor Dr. Niranjan Hiremath, internationally trained cardiac and aortic surgeon and surgical lead of the Pan Apollo Aortic Program. And here we have him. Doctor, thank you for joining me. It's an honor to have you on Heart Health Conversations. I'm looking forward to revisiting this journey, not just as your patient, but as someone committed to helping others through awareness.
Hi, Shehzad. Absolute pleasure to be here and honored to be here. And I must say, I'm very proud of you for what you're doing. And, the whole world knows what a heart attack is, but very few know what aortic diseases are. So you're doing the right thing. It's absolute pleasure to join you. And let's, hope for the best podcast.
Thank you, Doctor. So, without any further ado, uh, I would like to begin this. Doctor, before I met you, I'd never even heard the term aortic disease. Like most people, I thought heart disease meant blocked arteries, heart attacks, angioplasty, and or bypass surgery. I had no idea there was another condition that could be just as dangerous, if not more so. My own diagnosis came as a complete surprise because I'd never even heard of an aortic aneurysm. So, for someone hearing this term for the very first time, what exactly is aortic disease?
That's a great question and a great point to start with. Heart attack is a very common term. Everybody knows, what a heart attack is. Everybody knows what a blockage is. But let me put some straight facts in front of you. Heart disease, any kind of heart disease, is the number one killer across the world, and the same even in India. Okay, and in that, heart attack comes at number one, which is blockage, sudden blockages of coronary arteries, arrhythmias and arrhythmia related structural problems of the heart like valves and things like that comes at a second place, where can cause sudden death, like especially you see young athletes suddenly collapsing on the field. But the third most common cause of sudden cardiac death is rupture of aortic aneurysms. And this is something which basically is less talked about because it's less detected. The understanding of this disease is very low in the common community, and somehow it is underdiagnosed as well. And right from the doctors, the general practitioners, the physicians, to the common patients, usually aorta and aortic disease are alien terms. So, when I started my career back in India about 2, 3 years ago, and also about 15 years ago, when I saw aortic diseases, and when, as a vascular surgeon, I was treating aortic diseases, patients would come at dire situations, dire emergencies, because 75% of these problems are silent. That's why nobody knows about it. Unlike heart attacks or, valve problems where you get progressive shortness of breath, you get short, chest pain and difficulty in climbing stairs, working. But aortic aneurysms, they don't really warn us. They keep growing silently, and eventually they just suddenly rupture, or we have a condition called aortic dissection. So the awareness is very low amongst people. And in fact, if I have to just tell in layman language, aorta is the main highway system of a body. It carries blood all the way from the heart. The moment the heart pumps, it carries about 150 to 200 millimeters of mercury of pressure all across, right from head to toe. So it has to, be able to withstand that much amount of pressure. So aorta is the main pipe, the big red pipe that we see in all anatomy books. And this too can be affected by the same risk factors that can affect, heart attacks and other problems. So awareness is everything. That's why we don't really see this problem that commonly, and not many people know about it. I'm sorry, I can't hear you.
So, understanding that now, it makes sense why I never thought my own symptoms could be related to something so serious. So, looking back, I experienced a sudden tearing pain in my chest that lasted only a few seconds. It
I
disappeared.
see.
It disappeared so quickly that I almost ignored it. Later, I noticed I became mildly breathless, but nothing that made me think I was living with a life threatening condition. What symptoms should people never ignore?
See, in those 25% of patients who do have some symptoms, they are very similar to heart attacks. They're very similar to the way heart attacks happen. Like you get left-sided chest pain, shoulder pain, you get breathlessness, progressive breathlessness or rapid progression of breathlessness. A person who was able to walk about 2 kilometers in a day about 1 month ago suddenly is not able to walk 2 kilometers, is able to walk just 500 meters or 1 kilometer. And then they start feeling shortness of breath and they start getting chest pain. It's very similar. What I would like to highlight here is even though chest pain seems to be one of the most common symptoms and the most benign symptoms, not all chest pains are heart attacks, not all chest pains are, aortic aneurysms. But then, you might as well rule it out than be sorry about it that you didn't think about it and you didn't go to the hospital in time.
Yeah. Okay. Uh, if someone experiences these symptoms, what should they do immediately?
See, every clinic or every city has hospitals and clinics where echocardiogram is readily available, ECG is readily available, and they have cath labs coming up in tier two, tier three cities. Um, so these three modalities, that is, as soon as you go with chest pain, irrespective of what age you are at, whether you're 25, you're 30, because nowadays everybody is getting it. So no matter what age you are at, if you have chest pain, absolutely don't ignore. Don't tell yourself that, oh, okay, home remedy will work, maybe just gastritis. I have many real life anecdotes where people thought it was gastritis, and when they went to the hospital because the gastritis symptoms didn't subside, they were having a massive heart attack. And I do have anecdotes as well that where the patients reach and they don't make it after that. So you go to the hospital, they'll do an ECG, then they'll do an echocardiogram. Echo is the ultrasound of the heart. We look at the function of your heart, we look at the valves of the heart, and then finally, if needed, and if there are suspicion of ECG changes, then they will do something called a coronary angiogram. We shoot some dye in the wrist. It takes about 5 minutes, and but we can get to know if there are any urgent, any significant blockages in your coronary arteries or not. So these three tests are readily available everywhere. Just get yourself checked. It may be negative. If nothing comes out of it, well and good, you're safe, you can take home remedies. But there are many a times you may be having a heart attack or you may be having an aortic aneurysm. So echocardiogram also picks up the aortic dilatation. Aortic aneurysms can be picked up on echocardiogram. If your aortic valve is leaking, that can be picked up on an echo as well. So echo is just a simple ultrasound, and that's enough to pick up any kind of aortic aneurysms or heart problems.
Okay. And speaking of the CT angiogram that you said, there is a lot of this myth, if I may say, that they induce a dye in your body. And so, can you just tell for
Yeah.
our viewers how safe
See,
is it, and how often can that test be done?
yeah. See, there are two main common types of angiograms performed. One is a plain coronary angiogram or a simple angiogram that by injecting dye into the wrist, it is done in a cath lab. It takes only about 5 minutes. The other one is a CT. CT is a machine which takes multiple X-rays, and we pass dye through your vein through a intravenous cannula, and you lie in the machine for about 5 to 10 minutes, and that scans your entire body or your entire heart and vascular tree. So these two are slightly different. The only time when we cannot do this or shouldn't do it or be cautious about doing it is if you're having kidney problems. So
Okay.
we always do a serum creatinine or a kidney function test. So
Okay.
this is the first thing that the hospital will do. So as soon as a patient goes to the hospital, they do some blood tests. And those blood tests basically tell you kidney function tests and how much hemoglobin you have and those kind of things. The second question they'll ask us is if you're allergic to any kind of iodine substances. Okay. So if anybody has any kind of allergy to iodine related substances, then they are not, they're not great immediate candidates for angiogram. They need to go through a medical screening to have an angiogram. Apart from these two contraindications, for everybody else, it is very safe to undergo an angiogram. It takes a small amount of dye. All they have to do is drink 2 liters of water after the CT or after the angiogram for the next 24 hours. But it gives us every information we need, everything. It's a literal tunnel or a microscope to look into the body. Every part of the body is lit very well, and that's how we pick up many diseases.
Fantastic. So, thank you for clarifying those few doubts and understanding that. I will move forward now. So, Doctor, let's go back to the day we first met. When you looked at my reports, what was my diagnosis and how serious was my condition?
See, the moment I saw your report, I read was you have aortic aneurysm. Luckily, you already had a CT scan done in an outside hospital. A very good physician of yours had already seen an echo. He saw that your valve was leaking. And whenever an aortic valve is diseased, we always look at the aorta, because aorta and aortic valve are almost one structure. They are joined together, and aortic valve is the main gatekeeper of your heart. So if
Okay.
that is affected, there is a good chance that your aorta can be affected, which is your main blood vessel that the heart pumps into. And when I looked at your CT angiogram, if I remember, your aorta was dilated to close to 6+ centimeters, and which is pretty large. A normal aortic diameter is maximum of 3.2 centimeters approximately in any healthy individual. In women, it is 2.8 to 3. In men, it is about 3 to 3.2 centimeters. But in your case, it was almost 2.5 times the size of it. Imagine aorta like a balloon. The more you inflate, the thinner it gets. And eventually, it just ruptures, it just bursts, right? That's exactly what happens to the aorta. And as per worldwide data, if a person starts, the aorta starts dilating beyond 5 centimeters, the risk of sudden rupture exponentially increases. Up to 5 centimeters, you don't have much of risk of sudden rupture or dissection. But
Okay.
after 5 centimeters, it goes to 20%, 40%, 60%, 70%. So you were basically at a risk of about 20 to 30% of sudden rupture or dissection when you came to me. So the moment I saw it, one, of course, I'm an aortic surgeon. For me, it was not unusual, but for a person like you who's never heard of aortas, becomes a very important talking point. So I had to explain to you what it is and how serious it is, and why we need to fix it immediately. Otherwise, while you wait for surgery, you always run the risk of rupture or dissection, which is about 30%. So you go home, you go back home, you're waiting for surgery. In your head, you're carrying 30% risk. You're sleeping in the night, you're carrying 30% risk. So you have to live with that 30%. So when I explain to you everything that, look, the valve is not working properly, your aorta is dilated, you're at a risk of having aortic dissections, and plus, I also remember your blood pressure was on the higher side. Of course, it is also the white coat syndrome. You saw me, your blood pressure went up. But that's not the only reason. Blood pressure, chronic, uncontrolled high blood
Okay.
pressure is
Okay.
one of the key reasons why aortic aneurysms happen. If a person is diagnosed with high blood pressure, say 5 years ago, 2 years ago, 10 years ago, there are many people who don't believe in taking medications. They say, you know what, I feel okay. I don't need the medicines. I don't need the blood pressure medications. And I remember when I met you, your blood pressure was 160, 100, 150, 100. And, that is unsafe when you have an aortic aneurysm. Aortic aneurysm and high blood pressure are best friends, and the moment the blood pressure goes up, the aorta threatens to rupture. So, once you understood the seriousness, that's when, we knew that we had to fix you.
Okay. So once I understood how serious my condition was, the next question on my mind was what happens now? Once the diagnosis was clear, what were the options for the line of treatment for me? Uh, and Is this the whatever line of treatment that you gave me? Is it is can the medicines reverse could reverse this condition?
See, aortic aneurysm is a mechanical issue. It's basically it's like plumbing, right? Your pipe is damaged, you got to change it. No amount of taping it or reducing the amount of water flow in it is going to fix the broken pipe. In the same way, even your aortic aneurysm is like that. It cannot be reversed. It's a mechanical problem. It's dilated, it's become big. It cannot be reversed. It has to be fixed through surgery. And surgery is the only way to approach an aorta. And we have plenty of, aortic surgery has evolved since the last 60 years. Can you believe it? 60 years we've been doing aortic surgeries. Very few people know about it even till today. And the best way to fix it is we put an artificial aorta. It's made out of nylon material. It's called a Dacron graft, and we use that to basically, rebuild or reconstruct your main aorta, which is your pipe, your blood pipe. And that's the only option. And in addition, because the valve was leaking, the valve was not healthy either. So that also had to be fixed. So we had to do a procedure called Bentall. Bentall is a procedure where we change the valve and the aorta simultaneously. And that had to be done. And, it went on well.
Yeah. Once once I made that decision, surgery became very real, and that's when the fear started to set in. I still remember asking you, "What if my heart doesn't start again? And what
Yeah.
if I don't come off the ventilator?"
Mm.
How do you address the anxiety of patients and their families, and offer reassurance who have these fears before and after the surgery?
See, there are two aspects of talking to families, which I always incorporate. One is I never sugarcoat words, but at the same time, I don't talk to families to scare them. We as doctors, we have a responsibility of presenting facts. Okay. And it has to be factual, it has to be based on international data, national data, and also my personal experience of seeing similar cases in the past. While we don't have to scare a patient, but we have to make sure they understand the seriousness of the problem. And I remember our consultation was 2 hours.
Yes.
It is a responsibility of a doctor to answer every single question a family or a patient has. Yes, some of the doctors, the time is limited, but unfortunately these kind of situations are so serious that we need to spend time with the patient, and there's no other way around. Yes, there has to be mutual respect for each other. The patient should understand that the doctor's time is also limited, and we keep questions straightforward. But we have to present the facts. And in your situation, all I knew was we had to control your blood pressure, and I had to offer you the best treatment possible. And you had already done your research, you knew where to go, you knew what needs to be done. So it's a culmination of multiple points. But if you're asking me how do I talk to families, I show my past cases, I show my past experiences, I draw diagrams, I explain what we do. I show CT scans of other patients to show as an example. And once I think the patients do understand, when I present so many facts, that they do understand, look, this is what it is, and here we have to face it. There's no running away from it, but might as well just trust. There is mutual trust. I trust you and you trust me, and my team, and we take good care of you.
Fantastic. Post surgery recovery brought its own set of challenges.
Yeah.
Uh, Many patients also have high blood pressure, diabetes, thyroid disorders, and or other medical conditions. How do these affect recovery, and what can patients do to recover well?
See, many people, I may be slightly off topic, but let me explain. See, sometimes patients think, okay, look, I'm fit all my life. How did this happen to me? You know, what happened? I thought I was being, completely looking after myself. But see, aortic aneurysms can happen due to many reasons. But if a person has been fit all his life, who's been active, eating well all his life, the recovery becomes that much easier, that much faster. So your baseline physical condition determines how fast you recover from a surgery. There are 70, 80-year-olds who are extremely active and they are still good candidates for open surgery. But there are also 50 years for 40-year-olds who don't look after themselves. They're in bad physical condition and they may not tolerate these procedures. So it's very important that you continue to look after yourself, continue to keep yourself fit. And basically that is how it determines. And how you see, you have, once you trust your doctor that he's going to do this procedure, there are a set of instructions we give every patient. Like, for example, in our unit we have a protocol. That protocol is handed over to the family and the patient, that the next 6 weeks, these are the protocols you have to follow. As long as you're following that, as long as you're looking after your vital parameters like your blood pressure, heart rate at home, making sure everything is under control, you should be good. You will be recovering in no time.
Fortunately, my timely surgery gave me a second chance, but recovery doesn't end well when you leave the hospital.
Yeah.
What can patients realistically expect in the weeks and months after a Bentall or a open heart surgery
Mm.
procedure, and when can they safely return to work, exercise, travel, and everyday life?
That's a great question. It actually varies from person to person, but on an average, the immediate recovery and healing takes place within 7 to 10 days. So most of the patients, about 80-90% of the recovery happens within 10 days. The skin incision, there's just a line here which will heal very quickly. Uh, the pain usually is maximum in 48, 72 hours, but the pain is usually well controlled with medications. But this lingering pain lasts about a couple of months, like one or two occasions where the pain can come from anywhere. But generally, it's not that painful. It's like, how you go to the gym, you're extremely sore, or if you have lifted some heavy weights and, you feel sore. It's usually that kind of pain, but not really the heart kind of discomfort pain. Usually, the patients are independent when they leave the hospital. You were, for example, yourself, you were already, walking around the hospital, exploring within 5 days. You were doing very well. But the first 10 days after you go home, usually patients can feel little tired, which is normal because your body takes time to heal from within. Good nutrition, good amount of protein intake is very important. But then about roughly about 3 to 4 weeks time, you'll start to bounce back and they can return back to say desk job in about 3 weeks to 4 weeks. I've had a 75-year-old patient who went back to work in 3 weeks after a Bentall hemiarch procedure.
Fantastic.
And we've had patients doing physical work after just 1 month. So it varies from people to people, but on an average I would say 1.5 months.
Okay, okay. What lifestyle changes or medications and precautions should every Bentall procedure or a valve replacement patient follow to protect the heart and aorta for the long term?
See, uh, the number one point that I want to highlight is whether you've had a surgery or not, BP, blood pressure, high blood pressure, hypertension is a killer. So, one, it leads to problems like aortic aneurysms. And then after surgery, if you continue to have high blood pressure, then whatever surgery has been done, either that can get damaged again, or the rest of the aorta can get affected if the blood pressure is not well managed. So, the first thing that I tell patients after aortic surgery is blood pressure management. Every day morning or any time you check, it should be early morning when you finish a good night's rest. That's when is the best time to check blood pressure. It should ideally not be more than 120, 130 systolic, which is on the top, the numerator. and the denominator should be less than 80, 85. As long as you're maintaining this, and to maintain this, we give certain medications, those have to be taken. They could be increased or decreased on follow ups. But blood pressure is number one. Second is sugar control. Some people have, diabetes, pre-existing diabetes. We have to aggressively control the sugar levels around in and around the time of surgery. Post surgery, if the sugar levels are not well controlled, they can lead to healing problems. And so usually what happens is, when in our center, we are a aortic center of excellence. So we have a comprehensive team management. There's a diabetologist, there is a cardiologist, there's a heart surgeon. All of us together, we work, and then we make sure that you are on the best possible medications when you go home. All you have to do is take care of these medications, follow up diligently, don't miss any of the follow ups. Every single follow up is important. There are changes made in every follow up. Echo scans are done periodically, and that's how you need to follow.
Fantastic. As I move to the next question, I see there is a user which has asked us a question. Maybe you can take this on. If are there, I'll just put it on the screen. Are there any genetic factors that make this more prevalent?
Yes, absolutely. That's a very good question. So, aortic aneurysms can occur either due to acquired or genetic factors. Acquired factors are basically high blood pressure, smoking, and long-standing diabetes, pre-existing heart disease. These are all acquired factors. Genetic factors, aortic aneurysms especially, are highest prone to genetic factors like Marfan's syndrome, people who are abnormally tall with very long hands, pigeon chest or dugout chest, who've got, who have retinal detachment at a very young age. They have to wear very thick glasses at a young age. Their hands and legs are abnormally long.
Hmm.
They have hyper extensible joints. These patients may have a syndrome called Marfan syndrome. It's a genetic disorder where there is a genetic defect by birth that can cause these, and this can also lead to heart problems like aortic aneurysm, aortic valve leakage, or called aortic regurgitation, or even mitral valve regurgitation. There are other genetic factors. There could be Louis-Dietz syndrome, Ehlers-Danlos syndrome. These are all connective tissue disorders. Basically, the tissue in the body becomes like stretchy, and that can lead to aneurysms. And if anybody has these physical signs, they have to immediately get themselves checked. Usually, young patients, like in their 20s, in their teenage, can also have aortic aneurysms. So, genetic factors play a huge role. And if you have an unknown if you have an unknown gene that can cause aortic aneurysms, and plus you're smoking, and then you're drinking, and you're not controlling your blood pressure, that becomes a recipe for disaster.
Okay. So during my recovery, I experienced gastritis, attacks of gastritis, referred pains in my abdomen and chest, and every new symptom increased my anxiety. In fact, I became hypervigilant of everything, especially for blood pressure. If there was an increase in a few numbers in mmHg, it used to play havoc in my mind, and then the numbers used to rise up even more higher. It was a kind of a loop that I was, falling into. So, which symptoms are a normal part of recovery, and which ones should never be ignored?
I think I must add, take this opportunity to add a point that not only medicines and blood pressure monitoring, it's important to do some kind of meditation. If you're prone to being anxious very quickly, if some patients are, they take the news well, they take the surgery well, they're not very paranoid. They are okay. They know they have to take time to heal. But there are patients who get really anxious, and they get very jittery about every small little thing. A small fever, or I wouldn't call it small, but a fever or a little jump in high blood pressure can cause anxiety. In those cases, try and practice some kind of meditation, something that calms you down. There are telltale signs of serious
Mhm.
problems post surgery, which the doctors usually will tell you. Unless those problems exist, I don't think you should ever get worried about anything after surgery. I always tell my patients, until I fix you, you're a patient. But once I fix you, you're not a patient anymore. We fix you so that you're not a patient anymore, right? So you have to stop worrying after surgery rather than worry more after surgery.
The worry should be just make it to the hospital in time, and
Absolutely.
let you guys, the clinicians, worry about the recovery.
Exactly. Which what happens most of the times for me.
Yes, great. So even after I started feeling better, I realized that recovery wasn't always straightforward. Uh, as my recovery progressed, I realized that surgery wasn't the end of the journey. It was the beginning of a lifelong care. What follow up tests should every Bentall procedure or a valve replacement patient have? How often should they be done? And what are you looking for during those checkups?
See, we almost routinely, every time a patient has aortic surgery, we do a post-operative CT scan. We look at the correction that we have done. Okay, so that becomes our baseline for the next coming years to come for the patient whenever he follows up. The second important thing that we do is we look at the echocardiogram to make sure the valve that we have fixed is working well or not. And and then we put them on medications. But after a certain point, I would say roughly from 3 to 6 months onwards, your life settles in. You get used to knowing that you had a heart surgery. It becomes a subconscious thing eventually. But it largely varies from patient to patient. I remember you had a lot of questions post surgery, but I do have patients who absolutely complain of no pain or no discomfort, even just 10 days after surgery. They say, "Doctor, I don't have any issues at all." So it largely varies from patient to patient. It's difficult to say, but usually patients do very well from 3 months onwards. They can go back to the gym, they can lift weights, provided your doctor has seen you before that, has cleared you before that. You can go running. I'm sure you're doing some excellent cardio workouts now, and
Yes,
I
I do.
think
I do.
yeah, you must also mention that how active you are. So I think it becomes a normal lifestyle after a certain point.
Yes, it does. There are some questions coming in, Doctor.
Yeah.
If we have the time, if my producer can just pop those questions on the screen.
Yeah, I can read it here. My son age
Okay.
12 is
Yeah,
having
somebody had asked about the sun, so
LDS.
yes.
Yeah. So if I'll change what type of this is an excellent question. So see, LDS is Lewis D syndrome. This is a
Mhm.
connective tissue disorder, can cause sudden aortic dissections or ruptures. I would say get an echocardiogram done right away to make sure that it's not increasing in diameter. But at any given point, if your son during echocardiogram or a CT scan, get a CT scan at 18 years of age, echocardiogram now, and every 5 years get an echo. If the aorta dilates to 4 centimeters plus, then you have to start thinking of getting an elective surgery done, a procedure called valve sparing surgery. If his valve is normal, um, someone like me can actually restore the valve functionality. We can retain your own valve and prevent putting in a mechanical valve or a biological valve. If the valve is normal, it can be saved. And if we do it in a non emergency situation, the risk of having the surgery is just 1 to 2%. It's not more than that. So, my suggestion to this person is get an echocardiogram right away. If on the echo, the aorta seems to be dilated, the valve is not working, then you'll need a CT scan now. If not, at the age of 18 or after 5 years, at the age of 17, you can get a CT angiogram of the aorta. If at any point the measurement is more than 4 centimeters, you have to visit aortic centers and we will do a surgery to save the valve and the aorta.
Any other question? I think there was something on the aortic valve. Genetic factor. All right, we'll come to that. So Okay, recovery isn't only physical, there's also an emotional side that patients and families experience. One thing I'll never forget is the way you and your team cared for me beyond the surgery itself. And I remember you even played music for me in the operation theater
Yeah,
just to calm me down.
yeah.
Uh, Meanwhile, my family spent hours anxiously waiting outside in the hospital corridors. How can we extend emotional support for both patients and their families in the surgical and recovery phase? When I say we, it's you clinicians and us patient advocates. Yes. How can,
See,
in
we
your view?
in our team, right from the day one, there's one point I always tell my team that for us it's a daily job. Getting patients under our knife is a daily job, but for them it's a once in a lifetime harrowing experience.
Absolutely.
And that is how we deal with patients. For us, every patient is important. Every patient is a new patient. And their family, every patient's family situation is different, their anxiety is different. We try to extend as much emotional and medical support as much as we can from our side. I think we are blessed to have some excellent team members who really contribute towards patient comfort and patient's family comfort. And we work together. We work together with a common goal that not only the patient should be medically cured, they should be emotionally supported as well. It's very, very important. But it also, because the amount of information about these conditions is so limited, that adds to the anxiety of patients. So someone like you, what you're doing, this excellent work of raising awareness and creating awareness about aortic diseases and surgeries, I think these are the kind of initiatives that really provide support. Like next time any patient is undergoing any kind of aortic surgery, they can go back and watch all these videos, and they can reach out for information. But we can assure you that we have a very holistic approach towards how we deal with patients. For us, every day is a brand new day, every patient is a brand new patient, and every patient is as important as the previous one or the next one.
I would, doctor, I would love to take this opportunity and offer, in case if you have a patient, I would definitely like to connect as a peer
Yeah,
and, give them the entire, thing so that the anxiety part and even for the carer also, we would try and definitely do our bit.
thank you.
Um, Thank you. One term that often mentioned alongside aneurysms is aortic dissection, and many people don't know what that means. Reference Senator Lindsey Graham, who passed away, may his soul rest in
Yeah.
peace, very recently, a week back, from aortic dissection. What exactly is an aortic dissection, and why is it considered one of the biggest emergencies in heart care?
See, the aorta is a thick pipe usually, okay? But then sometimes the aorta is made of three layers, okay? Um, this is anatomy knowledge, so pardon me if I'm using medical jargon here. But it is intima, media, and adventitia, three layers. Due to cholesterol deposits in the aorta or due to connective tissue disorders, one area of the aortic wall can become thinned out, or there can be micro scratches on the aorta or micro tears in the aorta. And
Okay.
when blood pressure rises beyond a certain point, like 150, 160 plus, that tear becomes a nidus for sudden splitting of the aorta. So the aortic layers split. It's a tear in the aorta, and it goes right from the heart to the brain to the lower body. It affects all the organs. So that becomes a dire situation. It happens within seconds. A patient will experience sudden massive chest pain and a
Hmm.
tearing kind of pain that radiates to the back. They can faint, they can have arm pain, and this usually happens very suddenly. The moment this happens, the risk of a patient dying is 25%, right away, right away, the moment it happens.
Okay.
I would say about 3 out of 4 patients don't make it to the hospital out of 10 patients who have aortic dissection. They don't even make it to the hospital. I've had patients who make it to the hospital but don't make it to the operating theater in time. So that is how dire this emergency situation is. And there are lucky few, about 5 to 6 out of 10, who eventually do make it to the operating theater. And if they are in the right place at the right time with the right team, then
Okay.
they will end up having their lives saved, and they live to for many more years ahead. So that's why it is such a dangerous situation. And it basically, aortic dissection, once this tear happens, it cuts off blood supply to either the brain or the organs or the kidneys or the intestines. And sometimes those can kill a patient as well. Hence, it is a very deadly problem. Every patient who has type A aortic dissection, right from the start, 25% mortality rate, but every hour they wait, every hour they go to different doctors, they go to different centers, they seek multiple opinions. Every hour the risk of dying increases by 1%. So at the end of 24 hours you have 50-50 chance of living. Okay. So my urge through your podcast is, any patient who has a diagnosis of dissection, aortic dissection, should absolutely immediately seek help and get it treated as soon as possible.
Okay. Also, I was reading on your LinkedIn. There was a very interesting case that of a 40-year-old man that was. Can you just talk 2 minutes on that?
Very recently, I had a patient who, I'll give you an example. He's a very young gentleman, um, roughly around our age. And he basically was diagnosed with high blood pressure for, about 2, 3 years ago. Nowadays everybody is stressed about so many things. He was stressed about his work. And for whatever reason, his friends told him, or his own idea, that he thought, okay, I don't need any medications for high blood pressure, I can take care of it. And his blood pressure probably was going up. He also had a condition called bicuspid aortic valve, where about 10% of patients in India, 10% of general population, are born with an abnormal valve, aortic valve, called bicuspid valve. Usually, nature has given us a tri-leaflet valve. There are three leaves in an aortic valve, but
Hmm.
some people are born with two leaves in an aortic valve. They are even more prone, 60% more prone to aneurysms than a normal general population. So this gentleman had a bicuspid valve. He had an aneurysm which was not diagnosed, which he didn't know about. He didn't have any symptoms, or probably he didn't pay attention to it. Then he had high blood pressure, which he didn't control. So he had all the ingredients of having an aortic aneurysm. So
Okay.
this went on, and all of a sudden he had chest pain, back pain. He went to the hospital. He initially thought it's just gastritis, got some local remedy. It didn't go away. He went back to the hospital again, had an echo, and that's where they found there was a tear in the aorta, and his valve was leaking as well. And the next thing you know, he has an 8 centimeter, which is almost a size of a small football, and which had already torn, and it was already rupturing into the heart. So he was extremely lucky to reach our hospital in time. We picked him up in an ambulance. We got him to our hospital, operated on him in the same night. Our entire team, we have a dedicated center of excellence where the team members are ready for such cases at the snap of a finger. And everybody were there, and we operated him overnight. And the next thing he knows, he's sitting up in the ICU and he's looking at me. He's like, "Doctor, I don't know how this happened." I said, "Well, all the warning signs were there. You didn't, pay attention to it. Your body kept telling you, and but you thought that you got it under control, but that's not the case." So now, when he left the hospital, he promised me that he himself, his health is a priority, and everything else comes next. So not all of us have to wait for these situations.
Absolutely. Saved in the nick of time. And kudos to you and the entire team.
Yeah.
And a big shout out to the Apollo team there to saving life. Okay. My next question is one topic that many patients are never told about is prophylaxis. Um, okay. I'm getting these questions. We'll just take this question
Yeah.
after I finish with my question.
Yeah.
So, prophylaxis. Could you explain what prophylaxis means after aortic surgery or valve replacement? I remember you advised me to be very careful, especially during my dental and other procedures.
Yeah. See, there are two types of prophylaxis we are talking about. One is, of course, uh, preventive, like prophylaxis, in the sense, you take precautions to prevent such problems from happening, like taking timely medical attention for your high blood pressure, or sugar, or cholesterol, or other issues. But your prophylaxis that we are talking about, once you have surgery, we have installed artificial materials in your body, which means your immune system is always acting on a foreign body inside your body. So there is a possibility that it can get infected if we do not take care. One of the most commonest routes of spread of infection is if you have a dental infection post heart surgery, you'll be at high risk of getting infection of the prosthetic material that we have put in your heart, especially artificial heart valves. That is one precaution we tell you. The second precaution is, of course, to maintain your blood pressure and make sure your blood pressure medications are taken. We tell you to keep your cholesterol levels under control, because rising cholesterol levels can cause multiple deposits in other parts of your body, or even in the artificial valve that we put in. The cholesterol metabolism can hamper and cause early degeneration of a tissue valve. So,
Okay,
there are numerous medical things that can happen post surgery, and prophylaxis means preventing those from happening.
fantastic. Doctor, what surprised me most was how subtle my symptoms were. I experienced a brief tearing chest pain that lasted just a few seconds, followed by mild breathlessness, nothing that seemed out of the ordinary or alarming at that time. Looking back, I realized I was living with an aortic aneurysm without even knowing it. I also learned that many patients have no symptoms at all until a major event like a aortic dissection occurs. My end question to you is, why are aortic aneurysms often called silent killers? How can such a serious condition go unnoticed for so long? And who should consider getting screened before it becomes so dangerous?
Yeah, that's a very good closing question, I think, because see, many people nowadays we are seeing in social media, a young person is working out in the gym and he suddenly collapses. There is a person who's dancing on the stage and he suddenly collapses, especially younger people. You never know who's suffering with genetic disorders. You never know who's suffering with a family history of aortic aneurysms. Like somebody pointed out, there is an LDS syndrome. That LDS can be genetic. It could go from children to children, offspring to offspring, siblings, mother, father, brothers. It can exist and circulate within the family. So we don't really know who's suffering from what. So the ideal advice that I would give is, every person, once they hit 18 years of age, a normal person with no family history of sudden cardiac death, at the age of 18, get an echocardiogram, ECG done, and it's like a cardiac screening, okay? And after the age of 30, if any person starts developing chest pain, sweating, especially on exertion, who's not very active, sedentary lifestyle, who's not walking enough, who's not doing enough exercises, who's not watching what they're eating, they live in a very high stress environment, less sleep, then start screening yourself from the age of 30 itself. Now, some of the tests, of course, all these tests have to be done provided you consult a cardiologist or a cardiac surgeon, and they are ECG, echo, treadmill test, CT scan if indicated, and we do some blood tests like lipid profile, and then some of the times we look at the entire cardiac enzyme and cardiac profiling that we do. And there may be sometimes there are family history of high cholesterol levels, family history of high blood pressure. They don't need any triggering factors. So these can exist even without your knowledge. And the reason it's called a silent killer is because the aorta basically tolerates a lot of pressure for a long time. Okay. It is designed to tolerate that kind of pressure. And it's a very slow growing process. up until 5 centimeters, it grows
Hmm.
very slowly. But the
Okay.
moment it hits 5 centimeters, it starts growing rapidly. That's when the pain actually sets in. But before that, there is no warning signs because it grows extremely slowly and nobody will know about it. There are many situations where a person goes to the hospital for just screening, just cardiac screening, and they end up having, they're getting detected with an aortic aneurysm. I know many patients like that
Hmm.
who have
Hmm.
just gone for some other screening and they are detected with aortic aneurysms. That's because they're usually 4.5, 5 centimeters, which is the cutoff. After 5 centimeters, when symptoms will start, and that's when the aorta really starts being under high pressure, and it starts stretching, and that's when the symptoms set in. But I'll also give you another fact. Aortic
Hmm.
dissections most commonly happen between 4.5 and 5.5 centimeters of aortic diameter. Not more. I mean, it happens after that for sure, but
Hmm.
in this diameter also it can happen. And that is the diameter, that's the size of the aorta, 4.5 to 5 centimeters, where many people don't have any symptoms. That's why it's called a silent killer.
Oh, so right,
Yeah.
right at the end, it starts
Yes.
to blow up.
Yeah.
Well, thank you for that question. And before I move to the next segment, I have this question here on the chat window, which I'll just,
Yeah.
it's there. A user has asked us, what are the risks in Bentall surgery, survival chances? Is there any other techniques without an open heart surgery?
See, Bentall surgery is basically reconstruction of the aorta. We do Bentall surgery through a mini incision as well, but not every patient can get it. Depends on the anatomy of the heart. The survival is in today's day and age, as of now, 2026, the risk of having that surgery is just 1 to 2%. But it has that risk of 1 to 2% is in specialized aortic centers called Aortic Centers of Excellence. Those are the most recent guidelines that have come out. And yeah, the survival is normal after that, provided the valve is not changed. If a mechanical valve is put in, a mechanical valve has 5% chance of failure throughout the life, also 5% chance of blood thinner related strokes and sudden bleeding. On the other hand, tissue valves don't have such risk, but they have a limited lifetime, like about 15 years, 20 years, beyond which they will start to deteriorate and you may need another procedure in the future. But now, times have advanced. We do have non-surgical ways of doing it, but that technology is limited only to patients who are not fit for open surgery. It cannot be done in healthy individuals who can tolerate a surgery, and because that technology is not that far advanced to be foolproof. So right now, Bental, for us, it's one of the most commonest procedures we perform at our aortic center. We do roughly about 50 to 60 Bentals in a year, and the risk factors are all in single digits, maximum being about 4% risk, but otherwise it's quite routine. And if you maintain your blood pressure well for the rest of your life, you can live up to 60, 70, 80 years without an issue.
We have Annie here from Think Iota, and she has a statement here. Uh, we'll just put that on screen. Recognize that tearing chest pain is very significant for an aortic dissection. Thank you, Anne, for your statement.
Absolutely. It's a very specific symptom, that patients describe. They say that, it just started here and I feel like somebody's stabbing my back. And, it's a very telltale sign of an aortic dissection. And I think through medium like yours, is how we need to raise awareness. Thank you, Anne, for that, the right statement right now.
Yes. So before I move to the next segment, I just want to give a shout out to Think Iota and Marfin Foundation, in who have uh, very graciously helped me to promote this event, and our other friends who've joined all the way from Australia to Japan to Singapore to Europe and all across to the US. Thank you very much for your support. Doctor, would you like to take a minute and have a glass of water before we move to this next very interesting round of questions?
Sure.
I call, I call it the cardiologist's choice. Uh,
Yeah.
what I'm going to do is I'm going to give you two options because we are nearly ending on time here. You tell us which one you would choose and why. So, my first one, blood pressure or cholesterol. Which number should people pay closer attention to?
I think blood pressure would come on the top, then comes the cholesterol. I mean, both are important. They go and hand in hand, you know. But the first thing is blood pressure. Blood pressure can really, kill a person, and then comes the cholesterol.
Okay. Smoking or vaping, which poses the greater risk to heart health and should either ever be considered a safe alternative?
Both. That's my point blank answer. Smoking and vaping are the same in the sense they pose the same risk factors. Nicotine is the base substance at the end of the day, and nicotine is the culprit, and more than any other substance. Um, Smoking and vaping have never been proven to be good to the human beings ever. So there are no studies that say one is better than the other. Both are equally bad. uh, Most of our patients on our operating table are smokers. So, yeah, if somebody has lived 70 years, 80 years smoking and still doing well, they are just chosen ones. But, it's a ticking time bomb, and things can happen at as young as 20 when you're smoking, or as old as, 70, 80.
Fantastic. The next one is treadmill test or stress echocardiogram. When would you choose one over the other?
I mean, if your treadmill test comes back positive, we could do a stress echocardiogram. They both are two different things. Treadmill test basically looks at the electrical activity of your heart when it is under stress. Okay. But echocardiogram, a stress echocardiogram is when you put the heart under same stress, but you look at the heart function, you look at the valves, you look at if somebody has borderline valve narrowing, valve disease, that can get exaggerated under stress, or that can produce symptoms at under stress. So they both are two different tests. I wouldn't say that one is different than the other as such. I mean, they both are different actually.
Okay. Salt or sugar, which is the bigger enemy for heart health?
Sugar first, then salt.
Okay.
Both are equally bad. It's like choose what is worse and worser. So, so um,
Well, let me tell
eh,
you, all the tasty things, then you, as per you, are not good for the heart.
anything white, anything white is dangerous. Um, Sugar, refined flour, salt, white bread, starchy, refined starch, um, to a certain extent, processed or highly processed milk, um, highly processed cheese. These are all bad.
Oh God! Wait till my wife is listening.
Processed. You have to pay attention to the words. Processed, not the
Process.
organic, homemade, not the organic stuff that you get in your local markets, which
Yeah,
have limited expiry dates. Those are still healthy.
yeah.
Dairy products are healthy in a moderation.
Okay. Okay. Which one would you recommend people choose more often? Stairs or the lift?
Stairs, hands down. No matter how difficult it is, take the stairs.
No
Yeah.
more than two flights of stairs, I assume.
Yeah. I mean, it depends on your physical capacity, but yeah, minimum of. See, the I would rephrase my
Okay.
answer as the more active you are, the better. So
Okay.
you take stairs, you walk, but you clock 10,000 steps in a day, no matter what it takes. Wear a watch like this, track your steps, and whether it is taking flights of stairs or walking the distance, get 10,000 steps.
All right. Sleep or exercise? Which do people underestimate more when it comes to heart health?
Sleep. Sleep, number one. Sleep is basically like putting your phone on a charger.
Okay.
If you put your phone on a charger for 1 hour, you're going to have only 1 hour of juice left for the next day, right? You put it overnight, it's 100% charged. That's exactly how your body works. Your body heals, repairs, and grows when you're asleep.
That's a fabulous analogy. I quite like it. Very
That's
good.
it, period. There is no discussions, doubts about it. And then everything else comes.
Family history or lifestyle? Which should make someone more proactive about getting screened for your heart?
Family history. Family history. Family history is the lesser known killer for many people. Like, again, I'm going to come back to these media anecdotes that we get. Oh, young person, I don't know how he died. He lived a healthy life. Then suddenly we hear one of our relatives just passed away or something happened. He was, quite healthy. There are lots of genetic factors that run in the family, bad genes that run in the family, that can cause sudden cardiac problems or sudden aortic aneurysm related deaths. So, know your family history. If you have any family history of heart attacks, high blood pressure, sugar, connective tissue disorders, or sudden death,
Hmm,
go to the hospital straight away and get a screening done.
fantastic. Someone in the chat said, sleep with whom, doctor? I would say sleep with your smartwatch to track your heart resting heart value.
So that's exactly what the modern smartwatches do. They actually monitor your sleep. They see how much you go into REM sleep and NREM sleep. REM is the deepest form of sleep. That's your core sleep. That's when maximum repair of your body happens. And
Oh,
now the bands like, I'm not going to name the brands,
yes,
but
yes,
all the smartwatches now have sleep trackers. So
yes.
you actually sleep with the smartwatch, and that's the best thing to sleep with.
Very. There you go. Uh, Medicine or lifestyle changes, which has the biggest impact on long-term heart health?
Lifestyle changes, hands down. You can come off medications if you have incorporated major lifestyle changes. You can reverse hypertension, you can reverse blood sugar, you can reverse cholesterol levels, you can, unless they are genetic, unless they are far advanced, but borderline cases can be reversed many a times. Or if you're on 5 medications, you can come down to 1 or 2 medications. So
Okay.
lifestyle changes is everything.
All right. Walking every day or going to the gym?
At least walking every day. Gym, can mean many things. It's not just weightlifting. Gym can be,
So my
aerobics. Gym
reference
can be
is
something else.
long-term heart health.
Correct. So, walking as much as you can. As I mentioned, clock in 10,000 steps, whether you do it in the gym or do it outside. Clock 10,000 steps.
And my final question, one of my favorite ones, which I've been told to ask you, is wine or beer? Many people believe red wine is good for the heart. Is that really true?
The bad news is none of it is good. There have been, it's apparently called the French paradox, where somebody's told them that, 2 glasses of wine a day is all right. But, there is a discussion that it has certain antioxidants, which is good for the heart. But the amount of antioxidants needed for heart health means you have to have toxic levels of wine, which means you have to drink a lot to actually benefit from the wine. So it is not at all advisable because it also has other repercussions like liver, fatty liver, atherosclerosis, cholesterol metabolism disruption, a direct link to heart issues, direct link to high blood pressure. So alcohol is unfortunately not recommended by medical fraternity.
Okay. So before we close, again, I would like to, as a personal gesture, I would like to thank, especially those people or my family and friends who were there with me at the very onset of my first diagnosis. Was there here in Shimla, which was Raghav and Bankin, and Parul obviously was there with me, and then my friend Anirudh Singh, who helped me make it to the hospital to get the 2Ds and the CT NGOs done. And then my niece and my nephew, Dr. Aisha and Devdas, Nambiar, who actually searched and found you and got references from all over the world, and we reached you, and made in time. And I probably have got a chance to the second life, as I put it. So to each and everyone who has survived the aortic disease or made it to the hospital and have are living a helpful life, I think we should just take a moment and thank those people who came at that very moment to help us and make it to the hospital in time. Uh, and before I close, a sincere thank you to Dr. Niranjan Hiremath for taking time out of his busy schedule to share his expertise with us. We truly appreciate your valuable insights. And thank you, everyone who joined us from all across India and around the world. Your support means a lot. And if you enjoyed this episode, please like and subscribe and follow our channel for more heart health conversations. Our mission is to keep the patient and survivor perspective at the heart of every discussion while bringing you trusted experts' insights. And before I go, Doctor, is there a chat or a question that we have missed out? I will just scroll through. If there is one, if my producer can just flash it on the screen. Yeah, there is a question by a user. At what circumstances you have to decide that a patient needs a Bentall surgery?
Sorry, can you repeat that question again?
Can you flash that question, please? At what circumstances you have? I think I think there is some technical disconnect. Can you hear us, Doctor?
Yeah, I can. Please go ahead. At what circumstances you have to decide that a patient's need Bentall surgery? See, if a patient's heart valve is leaking or it's severely narrowed, and at the same time, the aorta, the main blood vessels, is also more than 4.5 centimeters in diameter, then that warrants a Bentall surgery. Bentall surgery is basically replacing aortic valve plus the aorta together.
Okay, Doctor. So there are a few more questions, but we'll take them on and we'll try and answer them on the chat, on our channel chat. Before we leave, Doctor, if you have a message for our viewers, uh, and then we can just end the chat
Yeah.
here.
I think I must thank you for this initiative. This is one of its kind in our country. We in India really needed patients in India really needed this kind of awareness. It's absolutely a fantastic initiative. Keep it going, and I hope this gains more traction and more and more people benefit from this. My message to many people all around the world is, at the end of the day, health is in our hands. uh, Nothing on this planet can buy us good health except our own efforts. So focus on your health. If we are alive, then everything else is, valid in life. So if you think that you are suffering from any problems, give priority, give time to yourself. Make sure you take care of your health. If you have to work out, if you have to lose weight, if you have to gain weight, you have to get timely medical attention, you come first, then the rest of the world. Thank you
Fantastic.
for having me.
Thank you, Doctor. Thank you very much. Bye bye, and good night, and good
Thank,
day from wherever you've joined. This is me,
thank you.
Shehzad from Apple Tree Health Foundation. Thank you. Bye bye.